Hey guys, so if you follow my channel a lot, you'll notice in the comments, you see a lot of people saying, holy fuck, like your lisp is so annoying, like I can't stand listening to you because of your lisp, and just hateful stuff like that. And I normally blame it on my camera, but now I have a brand new HD camera that I actually got for Christmas. So I don't know if I still have it. I might, but if I do, it's because I always have a mouth full of canker sores. Big problem I have with canker sores is you can't find that much information on them on the internet. Like you can find like stuff like Yahoo Answers, where people aren't really professionals. Like professionals haven't done a lot of research on them. They don't quite understand what happens. Like they understand like what leads to them, but they don't understand like what the chemical process is in your mouth, what causes them, like medicines you can take. Like when it comes to canker sores, there is no pill you can take or anything like that. They have like ointments and stuff that can kind of deal with the pain and kind of try to help soothe it, but you can't really find anything that helps. And when you're like me, I have 6 canker sores in my mouth right now. I have 2 along the side of my tongue on this side. I have 2 on my upper lip here and 2 on my upper lip here. I always have a mouth full of them, and I am almost constantly in agonizing pain. Like sometimes, like Christmas dinner, I could hardly eat. I think I had like a little bit of mashed potatoes with no salt because salt irritates the shit out of them. And I've been drinking nothing but water. I normally drink Coke, like constantly, and I've been drinking nothing but water. So I don't know if you're watching this and you've been dealing with cankers for a long time, or maybe you only have like 1 or 2 and you're sick of them. But if you're like me and you have cankers all the time, hopefully this video will help you. If you don't know, cankers can be caused by stress, poor dietary habits, and poor sleeping habits. I happen to harbor all 3. Ever since I was little, I used to get like 1 canker like once every 3 months, but I have had at least a minimum of 4 cankers in my mouth every day since September, and I am filming this Christmas Eve, like of the same year. In September, my grandmother was admitted to the hospital with cancer, and that's when they started, and she has since died, and my cat died, and a bunch of my fish died, and now my dog has cancer. So it's been nothing but stress for the past couple of months, and that's probably why, I know it's why my mouth is just full of them. Anyways, so I've been on a hunt and a quest to figure out what helps them and what doesn't. So this is just a couple of tips and tricks that will help you clear them up. But the best thing you can do for yourself is relax. Like try not to stress out so much. I know it's really fucking hard. Try to sleep better, get your 8 hours a day, and make them at a normal time, because trust me, if you're trying to sleep at like even like weird hours, your body can't do it, even if you are getting your full 8 hours. And try to drink more water, and try to eat less acidic foods. When you're not eating right, the acid in your stomach can build up. So one of the things you can do is, if you have a health food store in my town like I do, you can go and get these. These are bacteria pills. They have 50 billion cultures per pill. And you take one once a day around 2 hours after you've eaten food. And the bacteria go into your stomach and they kind of eat the acid. And it keeps the acid from coming up and eating away at your stomach. This doesn't count if you're throwing up or something. Also, when you have cankers, avoid drinking alcohol and acidic pop, orange juice, apple juice. Honestly, just try and stick with water. I mean, the worst thing that's going to happen is your canker's going to clear up, you're going to have nice skin for a while. Like, that's the worst thing that's going to happen. Also, if you have cankers, and a lot of them like me, honestly, avoid whitening products. Like, this is the only toothpaste I have right now, and I hate it. Avoid these whitening products because they have, like, bleaches in them. Like, you look at it and it won't say, like, bleach. But it does have bleaching products in them, and that can really irritate your mouth, and because they're really acidic, and that can help with the cankers. So try to stick with stuff like Sensodyne, or go to your dentist and ask him which one would be best. My dentist actually gave me Pronamel, but he only gave me like a little tube of it, and that's all I have left right now, and I hate wasting. I recently just started trying to use this stuff. I don't know how well it's going to work, but I know it soothes really well. It's the Oral-B ammo sand. Just so you guys know, I live in Canada, so this is all Canadian stuff, probably Canadian American. Anyways, what this stuff is it's a packet and it's all powder, and you have to mix one of these into an ounce of water, which is about a shot glass, with warm water, and like take half of it, swish it around for 30 seconds, spit it out. Take the rest of it, swish it around for 30 seconds, spit it out. You have to do that 3 times a day. I'm not entirely certain what it's supposed to do, but it's for gingivitis, canker sores, denture irritation, tooth extractions, and other minor mouth injuries. So you do that, and it's really, really foamy. It has like a peroxide in it, and that's where all the foam is coming from. I've also heard that people that swish with peroxide helps, but it didn't help me or my father at all, and my dad has it really, really bad. But what I did find that helps is Benadryl. Not the capsules, obviously, but like the liquid form. And actually, this stuff doesn't smell that bad or taste that bad. But it doesn't get rid of the cankers, but it does numb it. Holy shit! Like, you think Oral-B numbs it? This stuff, oh man, like it is the best, especially when you're trying to eat. It works right away too, but it only lasts for about 10 minutes. But it doesn't hurt that bad to put it on. Just don't swallow it or you'll be like knocked out. Also, I know it says Listerine 0, but I have the original Listerine in the bottle. I carry a little bottle with me because I travel a lot. But get Listerine. Listerine has an alcohol in it, like a really, really strong alcohol, and that helps to like kill a lot of the bacteria. And also, go to your doctor, because if you go to their doctor, they can give you something called Oracot. It is prescription. This is actually not mine right now. But what it does is you go and you dry off the canker at night, which hurts like a bitch. But then you put this stuff on, and it kind of like it seals it, like it seals the canker sore, and it's dry all night. And you have to go to bed, because if you're not, then you're up and you're playing with it. But if you go to bed, it keeps it dry, and you wake up and seriously you don't have a canker anymore. But if you're like me, your tongue gets swollen, you get some back here where you can't reach it, and like your taste buds are really, really bad. So honestly, the Benadryl will help with that. I've heard people using baking soda, but I just find that pisses my mouth off. Peroxide does nothing for me, but it might work for you. I've heard tea tree oil, but I use that stuff on my gauges, and it smells and tastes terrible, like absolutely terrible. Also, one thing I forgot to mention, vitamin B12. It is awesome, and if you take it on a regular basis, it will help to keep them from coming. And if you take 3 a day, when you have a canker, it will get rid of it a lot faster. Forgot to mention that. B12. Vitamin B12. Anyways, so that is my little speech. This hurt like hell to explain, because I really hate talking. So let me know if you have any advice for me or any advice for anyone else, or let me know if this helped you in the comment section. So, au revoir.